Hi everybody, so I'm Brandi Hight. I work at the National Vaccine Program Office at HHS, and our office provides leadership and kind of coordination among a number of the offices and agencies within under HHS who work in vaccines and immunization. So it's a pretty diverse area and includes communication, which is really the focus of this presentation. So today we're going to talk about Vaccines.gov, and in about 20 seconds I can just say that vaccines is a really complex communications area. It's a very complex area in the online world, and most Americans, most children are vaccinated. Vaccination rates are higher than they've ever been. So what's the problem? The problem is, there's always been people who don't support immunization for a number of reasons. They don't think it works. They think there's a conspiracy. They think that natural immunity is better. And so in the last 10 or 15 years, since that conversation that's always been there has kind of migrated to the online space, it's given rise to the dissemination of misinformation, perhaps to a degree that maybe wasn't there before. There was always media stories about this. There was always, private conversations, things anecdotally, but since it's taken on a life of its own and kind of this very vocal, very engaged community online, that it's starting to influence the vast majority of people who typically vaccinate, take their doctor's recommendations, but now they're starting to have questions too, maybe to a degree that they're hearing about things that maybe they wouldn't have heard about before. And so in November 2009, our office commissioned a series of focus groups with moms on childhood immunization. And it was really testing different messaging approaches. Do people want factual information? Do they want stories? Are anecdotes the right way to approach people? Or should be emotional appeals? And we really learned that, and these are real questions that came up during the focus groups, that nearly all the moms were supportive of immunization, but they all had questions they felt weren't being answered from their healthcare providers, from online research sources, from their peers. And out of those focus groups, one of the moms actually said, wouldn't it be great if there was something like a Vaccines.gov or something like that that would, could provide a single portrait and provide, the best, high-level information to learn about vaccines and immunizations for, the whole family, not just children, and then, direct you where to learn more. And so we moved into that process of starting to, organize and really get ourselves engaged to see, what we could do about it. And so in making our case, we analyzed the whole, basically online and federal and non-federal landscape. So going through all the federal vaccine information, every web page put up by CDC, NIH, FDA, and then also environmental scan of consumer health websites, provider sites, blogs, social media, and really seeing what are the questions people have, how can they be answered. And so in this process, we really defined our behavioral goals, which are really to help consumers learn the basics, send them to the right places to learn more, and really build skills, build that self-confidence that they can find the information they need and then talk to their provider about it. Because we've learned time and time again, and it was interesting when Jim was talking about patient engagement, is that in the vaccine space, a doctor's recommendation to get a vaccine is the #1 driver for health information and actually performing that action of getting vaccinated. So we really found that our general goal was finding the best content and featuring it in kind of a dynamic process. Let me go back. Oh, we're out of that. So this is an example of our homepage, and so this is what it looks like right now. You can see that in kind of our messaging technical models, our target audience for the website is women ages 25 to 55, since they're usually the primary health decision makers in their family. And you can see that based on quite a bit of usability research, we've actually organized the top headers by tasks, by the process of getting vaccinated. That's actually reflected in how we labeled things and how we organize the content. So learning about vaccine basics. One thing we found in the focus groups is that a lot of parents don't link the diseases maybe that are prevented by vaccines and the vaccine itself. They just think they're getting some abbreviation shot they've never heard of before, but actually linking what those diseases are, what the effects of them are with the vaccine recommendations. And so you can see we have a number of tools. Also, our content is driven by our partners. We work with a large interagency group of vaccine communicators from throughout the HHS agencies. And so right now there's a number of small measles outbreaks on the East Coast and the West Coast, and so we've been kind of choosing features based on that. So just one last thing, and kind of the innovative presentation things we're providing. This is an example of the immunization schedule provided by CDC. It's designed for healthcare providers, but it's given to patients often to kind of guide their vaccine decision making. And when we test usability testing, it's hard to read. It's there's all these acronyms, you don't know what they are. And so just as an example, this is the updated schedule we provide on Vaccines.gov, which tells you how many doses you need. This is for the from infancy to 6-year schedule, what the diseases are. Those link you back to the disease pages, kind of linking again kind of the behavioral goals that we want people to learn about what they need and then feel comfortable providing those tools and looking for those. And then a final thing, this is one of our disease pages. This one's about human papillomavirus. And I just want to make the point again about using formatting content in a way that's mobile friendly, but also kind of gets the key points out there at the same time. So here we've actually broken up our vaccine and disease information into vaccine basics, then the disease, and then take action, which provides you tools about payment, finding vaccines, things like that. And also we have an audio glossary and kind of putting tools in context. When you're reading content, it automatically populates with terms you may not understand in the content. And so again, really the lessons that we learned from the Vaccines.gov project were in our favor, and I didn't get to speak enough about this, but collaboration technology. We benefit from long-standing relationships within the government and and with our partners and our agencies to find the best content, provide it in a dynamic way, and also using the technological mechanisms to get it out there in the most dynamic way as well. We also brought in subject matter experts, usability experts, web team, communications people from the ground up, and that really streamlined our process in an interesting way. And then also we're staying small, we're being strategic. We launched March 31st at the National Immunization Conference here in DC. And so we're doing pretty well so far, but we're kind of we're very set on staying with our mission, providing the best information we can for consumers, answering their questions. And then in subsequent phases, we're kind of investigating new areas to move into, if it's mobile or record keeping or anything like that. All right, well, thank you.